on that IV that is already got the saline lock, like that arm, the armband, and have them state their name. And I usually, one of the things I do is I don't say, hi, Mr. So-and-so, or hi, Mr. Smith, because now I've given them their last name. So I usually say hi and introduce myself, and then I ask them to tell me their name. And then we'll get into talking. I say, oh, by the way, what's your date of birth? You know, because if you give them their name and ask them then to repeat it, if their short-term memory is intact, which may not be, they'll know what their name is. And that's, again, a good way to assess their, if they have dementia or not in our environment, because most of the time in her environment, she's not going to have to deal with Alzheimer's and dementia.
Better not. That would be a problem.
I've heard of early onset dementia, but not with them being pregnant, but and having babies. So I'm going to take a look, and I've done my hand cleaning. Some people don't like to be around the patients without gloves, but I'm really not touching it. I want to see what that dressing looks like. Tell them I'm going to do a dressing change before I get my supplies. And a lot of times I have done that with my morning assessment anyway, so I know what I'm doing. So I've gone, done my little assessment here. I'm going to go back out and collect my supplies. And I know I'm going to, because it's SPD, you're going to have these things available to you, these supplies here. And I have my tape. It just doesn't do well with me because it sticks to my gloves and then I can't get it done. So I put my tape on the edge of my bedside table. And remember I said I needed to date and time and initial with my, and I tear off a small piece. And today is the 21st. And it is now 10-something, 10:15. And when I'm doing the time, I do it now. I know I'm going to take a little bit of time to do the dressing change, but it's in the term of dressing change, exactness of time is not important. And then I'm going to initialize. This does not negate me from documenting that same information in the medical record, in the electronic medical record. So that's done. The other thing too is I don't like to do all the stuff and play around with the junk and then do the documentation of the pencil after everything's over, because I got done and washing my hands because I'm going to put the pin back in my pocket. If you forget to do this, you'll remember it when it's the end and you're trying to think of, did I forget anything? Okay, so that's done. All right, now I've already washed my hands. I've come back in, washed my hands. And now I'm going to don my gloves because I'm going to, actually I'm going to do this here first. Because I need to get something out of this. This is another thing, is most of the time, most of the waste is disposed of in the trash can, but we want you to dispose of your waste in a medical waste bag, because we want you to kind of get that concept if you have to dispose of waste in a medical waste bag. The policy now in most places, unless it's super saturated with blood, which is considered medical waste, it doesn't need to go in anything except trash, because everything is considered contaminated. So you look at your policy of what needs to go in medical waste. Normally, most dressing changes does not need to go in medical waste bag. But for our purposes, we're going to at least have you understand that concept and process. This says it's non-sterile, but for our testing purposes, the container is sterile. The reason is they say it's non-sterile is because this is pocket nurse for education. Somebody should order this and use it with a real patient. It's a liability if they have that this has been packaged sterilely and it's not. So for your purposes, this is a sterile container. Okay? Because the other real stuff costs a lot of money, and most of the time they're not. For dressing changes, you're not going to have kits like this in the clinical practice. You have to get your stuff separately from each area. Okay? So I'm going to go ahead and open this, and I'm going to make sure I'm opening it away so I don't put my hand over that sterile area. And I personally, because I know you only have a few kits, I personally like to take the complete thing off, because if I'm saving it to flip, to keep, this thing flips and gets in my way. So for testing, you're going to take this whole thing off. For practice, you may want to keep it on to help keep your supplies together. Okay? So that goes in the trash. And all I'm going to get out at this point here is I'm reaching through. Can you see that? Can you see it in the back? I'm reaching through to grab this red bag. That's the only thing I'm taking out right now. Leave that aside. That's my medical waste bag. And I need to do that before I take off the dressing. Now again, I don't like to set my medical waste bag to my side because that's junkus stuff that's close to me. If I'm in the bed, you could either set it between kind of the mannequin's legs or on the other opposite side of the mannequin, where the stuff is away from you. And I don't really need this either. Okay, so now I've set up my medical waste bag. Now I can undrape my patient here, making sure that they have, you know, their privacy, not keeping them totally undressed. And now I'm going to put on my gloves. Same thing. Those of you that go first will have to deal with the tape on the mannequin a lot stronger than those that are going right after somebody else because they had just put the tape on. So I'm going to, again, lift up my tape, and unfortunately this guy is sticky. We'll try to clean him. And I just kind of roll it under and loosen it up on the edges. And I kind of just roll so I'm not, again, there's some hairy backs, and you may have to deal with that. Usually there's not a lot, there may be some hair on abdomens if they're doing an abdominal dressing, but just have to kind of look at, you want to try to minimize pulling of the hair and causing discomfort for the patient. Now, if it's a significant dressing change where you know you have to do a lot of stuff, make sure you pre-medicate that patient if they have medication ordered before you do the dressing change and time it so it's at that good time that the medication will be effective. Because we do want to do pain management with dressing changes as well. I'm going to really have to clean this guy tonight. He's really goopy. And I just kind of let it see how that sticks to you. That way you know why I don't do gloves and tape. Just make sure I'm pulling it gently. He's a real mess. This has been sitting on since last January, so February 6th this was put on. So now you know why it's a little difficult. It's a long time to have a dressing on it. Okay. Now I'm got it unhitched here. I'm going to lift it up so I can kind of see what it looks like. So what am I looking for?
Color, smell.
I'm looking color,
Odor.
smell, drainage,
Smell.
the amount of drainage, size, okay? What you need to do for SPD is state what would be a normal finding. So what would be a normal finding for dressing drainage?
No,
Seriously.
Should you have a lot of drainage? If it's a dressing that you're just changing because you know it requires changing every so many hours.
Probably not.
Probably maybe scant to small.
Mm-hmm.
Okay, would be maybe the amount. What about the color?
Clear.
It should be more clear. Now, what are your color combinations terms that are medical terms besides clear? Serous, sanguinous, and serosanguinous. Okay, those are mainly the colors that you. So what's the difference between serous and serosanguinous?
More yellow,
small orange.
Yeah, more pinkish. Serosanguinous is more of the pink color, and serous is kind of that, clearish kind of color. So you're really sticking to more serous and serosanguinous as your best one. versus more of a reddish that you might get with the more bright bleeding. You'll have more red bleeding if it's a fresh bleed. And usually if it's a surgical wound where it's been, where you're not anticipating a lot of bleeding, you're going to have more of that clear to pinkish color that you're looking at on your dressing, or no drainage at all. So a lot of your expectations for what is normal will be the type of wound that you're looking at. Now your other mannequins don't have this nice wound here like this, that's sutures and stuff, and it's long, but we're also going to look at the wound itself. So once I look at this and I state in terms of what should be in terms of drainage with no odor, shouldn't have any odor if it's a normal finding on the wound, I'm going to then close it, and you can see how I get rid of it with my glove. I just take and wrap my glove, and that's why a lot of places they just put it in the trash, but we're going to put everything in here, okay? I then at that point will sanitize my hands again and put on another pair of gloves if I touch the patient, but I'm not going to end up touching this patient again. But I'll need a pair of non-sterile gloves. But I'm going to look at this. So this is a nice clean incision where the suture's intact, again, normal. I would want to make sure that the sutures are intact, or if they're not intact, it's not causing any opening in the suture line because the sutures are not holding the skin together. It's well approximated, so that's terminology on what you expect the incision line to look like. It's well approximated with no redness. And when you have initially taken off the wound with your gloves, at that time, just kind of touched it around that, not on the incision site, but around it to see if there's any tenderness or warmness. Aren't those signs of infection? So you really are looking for signs and symptoms of infection at the wound site. And your book kind of goes over the terminology with that. So you want to state what would be considered normal for incision site. No redness, no tenderness, no swelling. The sutures are intact and they're well approximated. Okay? Now you'll have some mannequins that won't have this visual on it on SBD because we only have 2 of these and we'll have 3 stations. So you'll just have to kind of simulate the fact that there is a suture line. Don't get yourself in trouble. Make sure it's just simple words that you memorize in terms of what would be a normal appearance for a suture line, okay? Because we're doing a surgical dressing change. So everything is good there. Now at this point, I'm going to, some people don't like the fact you always want to make sure your patient is stable if you leave the bedside. But again, I could have waited to take off my dressing after I set up my sterile field or do it before. It doesn't matter which way you decide you want to do it. Okay. I like to leave, air is good. It's a good healing, and you have had something closed for a while. So personally, I find with dressing change, this gives a time for that incision to breathe while you do your setup. Other people may not like that because it may mean that the patient could move, but if you again have to assess that is a patient going to be one that's going to flop and move, or will they be comfortable in this position if you leave it open? So it's a lot of things that you have to assess. Again, that's part of our job, is constantly assessing the situation. No 2 dressing changes may be the same in terms of leaving it open for a while you set up your field, or keeping it covered until your field is set up. It's really up to you. Okay, so now I'm going to move this so you can see it. And remember, after I take gloves off, I have to clean my hands, which I did. I remember that to do that because I don't want to have my hands dirty while I'm getting things set up with my sterile field. That's why 2 tables are nice, because I'm going to probably have to use 1 to get my field. So I'm going to take and set up my sterile field here. I'm going to move it off to the side. I'm going to do the same thing. It says sterile field. Isn't that interesting? Because the front of the thing said it was non-sterile. Now inside it says it's a sterile field. So I say that's why it's teaching. Sterile field, pick up here, and it has the arrow where to pick up. So you're essentially going to pick up it on the outside of your drape here, and you're going to just let it because this part here is not going to be one you're going to be worried about sterility. Move that over. And again, my edge here. I'm kind of doing this where you can see it, so. Also, to let you know, you can touch the outer edge here, and you can touch inside this outer edge up to 1 inch, because that's considered non-sterile anyway. Now, I like to have a large sterile field, so if I had this over the patient's bedside, this kind of, it wouldn't be like this for a bed, I would set this out like this, so I could have a large sterile field. So now your border of your sterility is on the outside here of the part that is visual. If I set it like this, which some of you may do, now this here and this here is considered non-sterile because it's now below the table. Okay? It's however you feel comfortable. You don't need a lot, and this may be fine with you. But you have to remember that if stuff falls over here, you have to identify it's no longer on the sterile border here. If it falls in this area here. Because this doesn't count. That's below. So that's why I like to give myself room. Because I'm clumsy as I get older. I like to set it this way. And you'll have 2 tables. Okay, now at this point here, again, I'm taking at the bottom of it here. And I'm going to go ahead and dump my supplies, not fling them, because there's a little tape in here. That's why you have this tape, because really you can't use this tape here the best way for the dressing. And these clear tapes, save them, because these are better ones for when you practice your IV. So save them. And then save your, trying to think if we got the devices yet. No. Save your safety pin, because we'll use your safety pin for NG with a rubber band as our securing device. Now, I'll go over that next week on why there's people don't do that. Do you still do that for Walton Beach, Deidre? Or do you use the lock device that for NGs? Tubes?
NG.
You still secure them with a rubber band?
We
We have the nose one, yeah, but
The nose
how
one.
about down on the gown?
Oh, normally I just take the tape and safety
Okay,
pin.
well, so you still use safety pins?
Yeah.
Okay,
Or do you just tape it, say, or just a piece
they
of
just
paper?
tape it.
Yeah.
North Okaloosa has special devices. So the book says evidence-based, the book says don't use safety pins, but for us, we use safety pins. Fort Walton Beach still uses safety pins. You can use safety pins safely without letting it hook the patient. So save those things. So now I'm gonna put this in the container, out of the container. And see, I just kind of plopped it there. This is still my sterile field. I need to save this container and keep it sterile because my sterile water's going in here. I can't forget, don't forget, because this is a step, critical step, to demonstrate that I now can add, and this one, some of these are old, so I'm going to work it loose a little bit, add a 4x4 to my sterile field correctly. And again, I'm opening it up away from me, where I'm not going over the field like this and taking my dangling germs that fall over out of my arms like this and hopping over my sterile field. You always want to minimize what you're doing over your sterile field. Try to keep it away from you. Okay? All right, so that's done. All right, so that's my sterile. Now, I can't touch anything without sterile gloves. All right, so I'm going to go ahead and do my water, my saline, not water, saline, and I'm going to demonstrate that I can lip it because this container has been opened. Now, when it's open, the nurse who opens it has to do what? Date, time, and initial. So what am I looking for? 24 hours. Most policy for solution and bottle is it's no longer good unless it's within 24 hours. Okay? So I also like to remember where I had lipped it, too, in case you're not going to use it for this skill. But if I had a moist dressing, I need to make sure I know where I lipped it, because then when I need to pour it or use it for irrigation, I know where the lipping. So I always get in the habit of putting my hand against the label, because then I know this side of the container is the part that I'm cleaning. Lipping is called cleaning. Your book doesn't even use the term lipping. So if you look for lipping in your Perry and Potter, that term can't be found. I don't know who created the term lipping, but this is why I think of lipping. That's where I think it came from. Or when you lick your lips, lipping. I don't know where it came from. Do you know where it came from? But it's called lipping. Things we come up with. You're going to have a trash can that'll be a lot closer, because you really don't want to keep your eyes away from the sterile field. And you just undo the cap here, and you take the solution here, and I go this way to lip it. Give it a nice little round edge here to lip it. Okay, that's lipped. Now I'm going to take, once it's been lipped, I'm going to pour some solution. For SPD, you just need to pour a little bit in your container to show that you did it. Okay, you know under that. I'm going to go ahead and put that back in the lid, and I'm going to move that away because I don't need it. All right. You'll have 2 bedside tables, so you won't have to do all the moving that I have to do to demonstrate how to put on my sterile gloves. Okay, because I have only 1 bedside table. All right, now I need to put my sterile gloves because now I'm ready. Okay, and when I open these up, who has not put on sterile gloves? Everybody's put on sterile gloves? All right. Woohoo! All right, so you know, right has a little thing that says right hand, left hand. Okay? So if it's like this, it's going to be the wrong way. All right? Or it could be that they put it in the wrong way when they manufactured it. I've had that happen too. All right, now I don't like these little wings hitting me, so I make sure I get them completely tamed without bothering me. And I don't like that flipping either. I just take my little table and I do a little ironing on my board here. And that way it doesn't flip back onto my field. Okay, little things you learn. All right, now I'm going to take and I'm going to put on my right glove first. Okay. And now I'm going to reach under my thing here and make sure I get my little hand underneath. I don't need you, little thumb. And if this moves around and you want to try to get your hand nice securely underneath, just hold that. You can do that. And now I'm going to take it, making sure I don't. Now, this is how it always happens, right? But this is sterile and this is sterile. I can get that straight. And then I just like to kind of make sure the tips are in there, but I'm not going to do much of anything else because I don't want to do anything where I'm going to bring that down and get that fixed. I don't really need that for this procedure, so I just need to use my fingertips. So I don't care that that's bunched. You shouldn't care either. Okay, now I'm going to go ahead and arrange my supplies. And at this point, this is a good time to remember to keep your elbows and your body kind of in that unusual, away from everything position. Kind of like this is hot and on fire. So I don't want to make sure I have anything that's going to touch anything. You guys see okay? I'm just rolling them up because I'm going to use that as my blotting device. This is my last thing, so I'm going to put it here. And in case somehow if I contaminate, I only really need 2 blotters. I'm going to get another gauze here for blotting because remember I put another 4x4 in there. I don't need the tape and I don't need the safety pin. I'm just going to set it over there. I do need this. And you are going to, these are for simulation, you are going to use these. And I like to take them out of the packet and I put them on my gauze that I'm not using. And then I have my trash bag here, and as long as I don't go down, I'm fine. Just drop it in there. You don't want to go down and contaminate, potentially put your sterile glove into a contaminated field here. So just drop it. Okay. Now how am I going to clean?
Clean to dirty.
Most contaminated or the least contaminated? Okay, so where's my least contaminated?
Suture line.
Okay. So I have a very clean suture line. The books, recommends that if you have a very clean kind of line, just to clean it, you start at midline and work back. And so I'm just gonna start midline here and kind of roll it, and it's done, and I put it in here. This one here, midline. So I really only need 2. I have a third one in case I needed it, but I don't need it. Okay, you have 3 in there, but you really don't need it. Okay, so if I don't need it, I'm gonna just throw it in here. Now I'm gonna blot dry the same way that I cleaned, which is fine. I'm gonna blot dry here and drop that in there, and blot dry here and here, just lightly blotting it. If you want to blot it this way, it's fine. However you want to blot dry it. I don't care how you blot dry it. I would prefer you to use the tongs for SPD versus taking your fingers and doing that, okay? We want you to be able to demonstrate using the instruments that you might have to use in clinical setting, okay? Once that last one's done, I'm just going to get rid of it. I'm going to take my ABD pad. I didn't open it, don't need it, till I get there. You have a blue line is the outside, and again I want to do it sterile, so I'm going to go ahead and put it on here. At this point, I don't need to worry about sterility, right? Mm-hmm. If you are gloved challenged with tape, you at this time can take off your gloves, but you shouldn't be if you have already put them out. You can see it's not sticking to my tape. I'm going to go ahead and tape it up here, just 2 pieces of tape for securing it, and tape it down here, making sure that it's covered. Like I said, your 1-inch tape is a little, you kind of have to put it here, you don't have as much surface, but that's okay. And then this has to be on where?
On the gauze.
On the perimeter, okay? So it can be on the perimeter on the outside. I don't really put it on the dressing in case the dressing gets super saturated. It'll saturate that date and time as well. So on the perimeter somewhere, either here or you can put it on the perimeter on the outside here. But don't put it on the dressing itself, okay? At this point, I'm done. I'm going to clean up. And I'm going to make sure the patient's okay, cover them back up. Clean my hands after I take off my gloves, and I'm done.